Say welcome to the closing. Goodbye to the rapporteurs, welcome to the closing. So, this is the end of the 47th World Conference on Lung Health, and our theme this year was Confronting Resistance. As I've walked around the conference, I've been inspired to hear discussion in every corner about how we can all unite to meet the challenges we face. Our message has been taken beyond the walls of the conference center, with hundreds of articles being written this week by journalists all over the world. We were not the highest trending topic on Twitter in the United Kingdom. That spot was taken by the Prime Minister of the country, but the conference was the second highest trending topic. In our inaugural ceremony, our keynote speaker, Stephen Lewis, spoke of lives lost in TB in 2015, stating, "There's not a tenable reason on earth to lose those 2 million lives, particularly since TB is curable." There are over 3,000 of us here, as I mentioned in the beginning of the rapporteur session, from 126 countries. I believe it is a community we leave here better informed, motivated, and stronger to saving lives. And with that, it gives me great pleasure to introduce our opening speaker, the Honorable Nick Herbert, who is Member of Parliament in the UK. Since becoming an MP, he has worked closely on the global problem of TB. In 2006, he co-founded the Global TB Caucus, which first met at the Barcelona Union World Conference on Lung Health, and continues to meet at each conference, bringing together parliamentarians from all over the world. Please join me in welcoming Nick Herbert to the stage.
Thank you so much. Good afternoon, ladies and gentlemen. It's a pleasure to be addressing the Union meeting again and to have been here all week in my capacity as co-chair of the Global TB Caucus. I said in a meeting the day before yesterday that I have felt sometimes that I have been repeating myself in talking about the caucus and what it is that we aim to do. But politics is often about repetition. So for those of you that have heard this before, please forgive me for explaining that we are an international alliance of parliamentarians that was set up 2 years ago in Barcelona at the Union meeting. We have been immensely grateful for the support that the Union gave us to facilitate that. And from those beginnings, I and my co-chair, Dr. Aaron Motsoaledi, the inspirational Minister of Health in South Africa, have been able, working with our parliamentary colleagues, to build a network that now consists of over 2,000 parliamentarians in 130 countries. And representatives of the regional networks that we have set up to give coordination to this group from the Americas, the Asia-Pacific, the European and the African regions were here this week. So parliamentarians have been present with you all throughout this week, listening to you, attending the meetings and talking about how we can try and give the political support to what it is that you are trying to do. We have set up this network not as an end in itself, but because we know that it is immensely important to secure greater political buy-in, both in high-burden countries and in those countries that will help us to deal with TB by being donor countries, to ensure that TB raises up the political agenda and is given the same kind of attention that other diseases were given in the past and are now well on the way towards being beaten. I said earlier this week that TB has been the orphan disease, having less political attention than others, partly because it's a disease that resurged not in the West but in developing countries. And it is essential that we persuade the world's leaders of the need not just to do something, because they expressed that in the Sustainable Development Goals last year, but of the need to provide the resources and leadership to ensure that those goals can be met. And that is my principal conclusion that I want to make today, and as a result of the discussions which the Global TB Caucus's Executive Committee had this week. The Sustainable Development Goal 3.3 is a fine thing. It says that TB will be beaten within 15 years. Actually, on the current rate of progress, we will be lucky if it's beaten in 2 centuries. And so what we have to do now is to show the world's leaders that they made that commitment but that there are things they need to do to ensure that that commitment can be met. And indeed, there are things they need to do quickly if they are to have any chance of meeting that commitment in the timetable that's available. So we have focused on the gap in research and development funding, which the Treatment Action Group and others have so persuasively pointed out, and the need to step up R&D funding globally to drive the new diagnostics, the better drugs, crucially the new vaccine that will enable us to prevent tuberculosis. And we need to point out the gaps in the program funding that exist. The world's leaders, again, can be pleased with themselves for providing resourcing for the Global Fund and having a successful replenishment. And I'm very proud of the role that the UK has played in that. But if the Global Fund's funding formula means that it is not focused on middle-income countries, if the burden of TB is found in middle-income countries, if only a fifth of the Global Fund's resources that have just been committed are therefore going to go to fight TB, that fund is not going to be sufficient on its own to help us meet the target of beating TB within 15 years. And so we need to show the world's leaders and ask them, what are they going to do to ensure that this target can be met, to ensure that the R&D gap can be closed, and to fulfill the promise which they made just 1 year ago. Here at this conference, we have heard about the science. We've heard the promise. We've heard the opportunities. We know that this is a disease that can be beaten, but we also know that despite the promises that have been made last year, despite the political will that has been shown in replenishment of the Global Fund, despite the commitments that are being made to R&D, it is not enough. And what the Global TB Caucus will seek to do on a bipartisan basis with parliamentarians who are working with each other in their own parliaments and across the world, we will give you all the political support that you need to make this point to the world's leaders. TB is now the world's greatest killer, the deadliest infectious disease. It cannot be ignored any longer. More must be done to tackle it, and it is our job to help you to make that point to those who make the decisions. Thank you.
Thank you, Nick, for those remarks and also for your leadership. And now I'd like to acknowledge someone who has shaped operations research at the Union. This person will be stepping aside from his official position with us at the Union at this World Conference. You know, when I was appointed Executive Director of the Union, I had a conversation with Tony Harris about the new job, and he told me not to worry. He said the first 13 months are the most difficult ones. And I figured this had to be based on some scientific evidence, some research if it's come from Tony Harris, it has to be so. Professor Tony Harris is the Director of Operations Research and a senior advisor. He has dedicated his a lifetime of growing our body of knowledge through research. But he's gone beyond that. He has pioneered new ways of ensuring that the research has an impact in the real world by using that research to influence policy and practice. And over the last few weeks, I've spoken to Tony's colleagues about his legacy. And I was amazed at the vibrant person I heard about, amazed at the admiration his colleagues have for him. Those stories echo many of my own, and I imagine they will echo your interactions with him too. For one, I was told just how incredibly hardworking Tony is. He has perhaps published more than anyone I have ever met. As one of his colleagues said, he's a powerhouse with a gentle touch. And it is this aspect of his personality, his gentle, hardworking nature, that is at the root of who he is. He commands respect, not fear, but through his genuine kindness and dedication to solve critical health challenges. I've not come across anyone who doesn't have a nice thing to say about Tony. I mention this because the respect that he holds has helped solidify the success of his programs. The other thing that I have heard repeated over and over again is that he's a rigorous person. And he's always brought that rigor to his academic research. According to a colleague, his writing is clear and its meaning and impact is weighty. Add to that his striking clarity of thought, and that's how he has been able to accomplish a lot. Another colleague captured Tony's work perfectly. His papers change practice. Governments have changed practice because of his work. People's lives have been fundamentally improved because of his efforts. His impact goes beyond the academic world because beyond his research papers, he has achieved real on-the-ground impact. In the words of a union researcher, he is the opposite of an esoteric academic. He thinks about problems and issues in a very unique way, and that leads to great results. Take, for example, his work on the introduction of HIV/AIDS treatment, or the fact that he has helped to build national public health programs in some of the most challenging places. Tony spent years in Malawi where he worked on both TB and HIV. He built such strong relationships and achieved such great results that the government tasked him to implement their first antiretroviral program. He stood up to those who questioned his plans, but with his characteristic gentle demeanor. One colleague remarked, "Lots of people have worked on HIV/AIDS programs and have not succeeded. But Tony delivered on his promise to make treatment feasible and accessible even against harsh criticism and incredible challenges." It was a difficult moment. It was one of the first times one of these programs had ever been created, and no one knew if it would be a success. But using very simple tools and by building strong relationship with stakeholders, he was able to get the challenging program to implementation and ultimately led it to great success. One colleague comments, "With the lens of pragmatism, he found a way forward and he changed lives of hundreds of thousands of people. If he had not forged ahead, those people would not be alive today." The last thing I like to share about Tony is that he is deeply connected to his work, to the people, to the ground, and to his colleagues. One of his co-workers recalled this. "We often get an email from someone asking us to get something done from them. But by the time I've read the email, he's already responded and started to work. No complaint. He has just a way of blowing through the task in a brutally efficient manner." Tony's brilliance and stamina and evidence-based approach to solving complex challenges have saved many, many lives and have made him a treasure to our community. He inspires everyone who crosses his path, and this is why he's made such an impact on the Union and the world. Ladies and gentlemen, please join me in acknowledging and thanking Professor Tony Harris. Tony, would you... And can you come to the podium?
Very nice of you. Thank you very much.
We have something to present.
Oh, thank you very much.
It's very heavy.
Very good. Thank you.
I think it's from here.
Jose, colleagues, thank you very much indeed. I'm very touched by those. I'd like to say things. First of all, thank you very much. Of course, I don't work in isolation. I work with people. I work with you. And I'd like to really thank those wonderful people, many of them here in the union, outside of the union, with whom I've worked over the last 25, 30 years. It's been a pleasure and it's been a huge privilege. I'd secondly like to thank Marigo, my wife, my rock, my support. Actually, my everything. And I'd like to take the opportunity to thank her and also thank all the wives, all the husbands, all the partners who support us in TB control. Because indeed, they make a real indirect contribution to tuberculosis control, and they are really some of the unsung heroes in this battle that we wage. Lastly, I'd like to say thank you, Jose. I'm retiring from full-time work, but I'm not retiring altogether. I'm going part-time. I don't know what time means. But I do know one thing. At the moment, my approval processes for work is dead easy. It's me, Jose Luis Castro, and we get on with things. From January the 1st, it's different. It goes me, my Minister of Home Affairs, my wife, and then it goes up the system. So I'll see how it goes, and I'll let you know in a year's time. Thank you very much indeed.
Fantastic. And as was mentioned in our HIV section meeting yesterday, we're very much looking forward to you having more free time to work with us in the section. Congratulations on such a great honor. So now it gives me great pleasure to introduce the last award. It's the Young Innovator in TB Research Award, which is a joint award made by the union and Otsuka. The representative from Otsuka is unable to attend and has asked us to say a few words here. The Otsuka Young Innovator in TB Research Award was designed to stimulate new thinking and creative approaches to TB care, mirroring Otsuka's global commitment to TB innovation. We congratulate this year's winner, who I haven't seen him, I hope he's nearby, Dr. Manish Parikh. His work is based on identifying a clinic or public health issue of importance in tuberculosis, then framing and answering a specific research question before translating the solution into public policy. An example of his innovative research is the high-impact work he has undertaken in the area of tuberculosis and migrant screening, which has been instrumental in directly changing clinical practice and public policy in the United Kingdom, as well as other international settings. Please welcome Dr. Parikh to the stage. The president taking care of me. Now, it gives me great pleasure to welcome to the stage our next speaker, the Right Honorable Louise Ellman, who is Member of Parliament for the Liverpool Riverside.
Well, good afternoon, everyone. I'm really delighted to be here with you this afternoon at this very important global conference. And the work that you're doing is absolutely essential. And this conference is pivotal in bringing together the work that you're doing across your networks and around the world in trying to combat the dreadful lung disease and TB, which is prevalent in all too many places. And I think that here in Liverpool, we are really very, very privileged for you to be holding your conference here. And I'm a Member of Parliament representing this part of Liverpool, so I feel it's a great privilege to have you here and to let us here in Liverpool hear about the vital work that you're doing and by holding your conference here, enabling that work indeed to continue. We do have our centres of excellence here, the Liverpool School of Tropical Medicine, the University of Liverpool with its Institute for Global Health, the Royal Liverpool University Hospital. And all of those organisations are integral to the work that is going on, but they are, of course, only part of that international network that makes progress in combating this dreadful disease possible. Listening to the reporters and the reports of the work that has been undertaken over the last 2 or 3 days while this conference has been proceeding, I think really enforces the importance of networking and of working together, of being collaborative, in being global, in bringing different kinds of expertise together, together with commitment, and expertise about developing knowledge and scientific knowledge, but that isn't on its own. It's about applying that knowledge, developing effective systems, and of course delivering effective healthcare so that people can receive the benefit of that knowledge and research in the way that applies to them, in the way in which they're willing to receive it. So that means that hand in hand with the development of scientific and medical expertise has to be development of health systems that really reach out to people and look for environmental concerns as very much part and parcel of what we're doing in all of our lives. And you might have seen the artwork that's displayed here on either side of this conference centre. The artwork that you can see has been donated by TB Proof of South Africa to the people of Liverpool. And thank you very much for that. One of the pieces of artwork will be received by the Liverpool School of Tropical Medicine, who were integral in bringing this conference here to Liverpool. And the other will go to Safe Productions, an organisation that uses artwork to engage communities. I know that you've all been very busy and engaged in participating in this event over the last few days, but I hope that you've also had the opportunity to see some of the pleasures of Liverpool and hopefully to experience some of those. And I hope you've enjoyed your stay here. It's certainly been a privilege for us to host you here at this very, very important international event. And I hope that you will all return to Liverpool, and perhaps as part of the work that you're doing, or perhaps on holiday as well. And I look forward to seeing you again on your return. So thank you for coming here, and thank you for the vital work that you're doing to combat disease and improve the health of people throughout the globe. Thank you very much.
Thank you, Ms. Ellman, Member of Parliament. I have to tell you, I found that Liverpool is one of the most friendly places I've ever been, and I have told several people, told several people of my experience getting off the bus and people helping me to get my luggage off the bus, and then everyone waved at me and yelled, "Enjoy Liverpool," as the first bus went by. So this is quite a friendly place, and we're very happy we have the conference here. Well, we don't have any other awards to be given out, but actually I get to do a tremendous introduction to you. For the members, you may be very aware of your election system, but just in case you aren't or you're not a member, let me just review it. And that's that at the Assembly last night, the members of the Union elected 3 more members to the board, repopulating the board. At the board meeting after the Assembly each year, the board re-elects its leadership. My 5-year mandate actually ended this afternoon at the last board meeting just before the rapporteur session. So I'm going to get to present to you your new president, but just before I do that, I just want to tell you that this has been a great honor and privilege for me to be your president for the last 5 years. I've always talked at many of these sessions about how much the membership of the union and the work of the union means to me, and I just have to give you a very big thank you, and to tell you that I really did want to underscore one of the quotes of Margaret Mead that I spoke about at the opening ceremony, and that's that it is a committed set of people that is the only thing that can change the world. And that's why I love the union, because this is the most committed set of people that I've actually ever met in my life. So thank you very much. So it's a great privilege for me to introduce to you the new president of the union, an old friend of mine and colleague, Jeremiah Chakaya of Kenya.
Thank you, Jane. To be honest with you, I wasn't quite sure that I was going to, or rather, I wasn't ready to speak at today's event. But yes, sometimes you are thrown into the deep end of the pool and you have to say something. But first, I'd like to thank the leadership of the union for the opportunity to serve you as the president of this organization over the next few months or years. It is definitely a challenging situation for me, but I'm happy that I have with me the past president, who has been a major inspiration for me over the many years that I've known her. I think I can't remember when I first met Jane Carter, but she struck me as somebody who is, number one, very friendly, very simple, and she had a peculiar motherly touch that I found very, I mean, it's easy to get along with her. She'll do things that most people in this room probably won't do, but she will be very particular about the kind of things that, make sure that you are comfortable. And I haven't seen anybody who's been as passionate and dedicated and energetic about the work of the union like Jane Carter has been. With her on my side, and I expect her to be on my side, she's not running away, I am feeling fairly comfortable that the work that needs to be done will in fact be done. We have a big task ahead of us. I think we all know the figures. TB seems to be staying, doesn't seem to be going where we think it should go. 10 million people suffering this disease and almost 2 million people dying. And we shouldn't forget that in some of our countries, in low and middle income countries, there are also other health problems. And there's nobody in that space at this moment in time to handle the huge problems that seem to be coming our way. When I was a young respiratory physician, I would go for months without seeing a case of COPD. Now I can't go for a week without seeing a case of COPD. So chronic respiratory disease is on our hands. And we need to start thinking about how the union could start filling that space, developing strategies for preventing and caring and treating people with chronic respiratory disease. With those, I want to say thank you very much for the opportunity to serve this wonderful organization as your president, and I hope I will fill the big shoes that that Jane has left for me. And if I don't, I think she will. I'll put something at the back of it so that she can remain as close to me as possible as we move this forward. Thank you very much. I had forgotten about this little task that I was told to do, so I'm very sorry about that. To appreciate what Jane has done to the union and for the union over the last few years as president of the union, I was told, requested humbly to give you this as a way of appreciating the work that you've done for the union over the many years. Thank you very much. Yes. Thank you.
Thank you.
I want to believe it's your turn to make final remarks before we close, Jose. So, up to you.
So I also, on behalf of the staff of the union, nearly 1,000 staff and nearly 26,000 volunteers that work in our organization, it's also my turn to thank our outgoing president today. As you know, Jane was appointed president at the Lille conference in October of 2011. And since that time, she has worked to transform this organization. No president in the history of the union has done more than Jane Carter to change the way this organization runs, the way this organization communicates, to expand its operations, to increase its resources, to meet the staff, the volunteers, and to increase the membership base. She has dedicated her entire tenure as president to travel around the world to meet with our members, to meet with our staff, to meet with our donors, with our partners, to listen. And she has translated that to the management team, to the staff, to the board, to turn that into policies, into actions to better this organization. She has also dedicated her entire professional career to working as a pulmonary physician in tuberculosis control. And this dedication can be seen in almost every aspect of Jane's life, be that with her patients, with her students, her associates, and here with union members and the team in the organization. Jane became the president at a crucial time in our organization's history. As we were approaching the centennial, she launched the president's centennial campaign, which, thanks to the generosity of many of you here in this room, has, over the last 5 years, built over $1 million to support education and research activities, and to set the organization to the next century. I think, we often, there's a famous Spanish poet who once said that with time, memories fade, and with the fading of memories, people lose gratitude. That is why countries sometimes have special holidays to commemorate those times and the sacrifices of previous generations. And I think Jane understood that. She wanted, in her tenure, to establish a centennial campaign to recognize those who came before us, those who founded this organization, and to remind future generations why we are here today, why the International Union Against Tuberculosis and Lung Disease exists. And we owe Jane a great deal of gratitude for this, and future generations will. So on behalf of the union, on behalf of my team all over the world, thank you, Jane. Thank you for leading us during these 5 years. And now I would like to welcome Dr. Jesus Felipe Roldan, a union member, to announce the 48th Union World Conference on Lung Health, for which the theme will be accelerating towards elimination. Jesus Felipe.
Thanks, Jose. Stay with me, Gustavo Saffert, Chief of Convention and Visitor Office in Jalisco, Mexico, and Humberto González, President of Convention Center Expo Guadalajara. On behalf of the Government of Mexico and the Health Secretary, Dr. Jose Narro, it's to me a pleasure to stay today with us and say thank you to the Union for elect Guadalajara, Jalisco in Mexico to host of the 48th World Conference in 2017. Mexico is a country full of history, which blends the best of the two cultures. It's a country with great natural riches, beautiful beaches, volcanoes, and variety of climates that not many countries of the world have. Mexico also has many pre-Hispanic pyramids and archaeological sites, as well as a mosaic of traditions reflected in crafts, cuisine, regional dance, and music. Meanwhile, Guadalajara, Jalisco, where the 48th World Conference is going to take place, is a beautiful and a colonial city with a rich history, home of the mariachi and the tequila, but the best is your hospitable, warm, and friendly people. Why is it important for Mexico to host the World Conference? It's important because the tuberculosis still represents a serious public health problem for the American region and a great challenge for health services, which record about 220,000 new cases per year, an increasingly growing number in drug-resistant cases, and comorbidity with diabetes or co-infection with HIV. Because it's necessary to strengthen the public policies to the tobacco control in Las Americas and in other parts of the world. Mexico becomes the public health center in the field of respiratory disease with this Congress, where representatives from the American region and from the rest of the world will share experience and reaffirm that commitment to prevent and control tuberculosis and lung disease. For example, 66 years ago, built a specific hospital in Guadalajara, Jalisco, to attend TB cases, the Western General Hospital. Today, that hospital only attends a few cases. Today, some people talk about the possibility to build more walls that separate peoples. Even that this World Conference helped to build bridge to bring people and give knowledge. Well, almost 60 years ago, 4 young guys from Liverpool said to us, maybe it's possible to change the world. And they said all I need is love. But certainly, only we need is make the change with love. I invite you to take a yellow submarine, cross the ocean. You have a year while I invite you to imagine a world free of tuberculosis. I invite you to imagine a world with tobacco control public policies. I invite you to imagine a world with less lung diseases. I invite you to assist Guadalajara, Mexico in the 48th World Conference on Lung Health. We are waiting for all of you. Thank you.
Ladies and gentlemen, that brings us to the end of the 47th World Conference on Lung Health. I think we all agree and accept that this has been a great event indeed, and our expectation and our hope, and with Stacy and the CCSA, all working very hard like they've done over the many years that they've been organizing this. We hope that Mexico will even be better. So with that, we want to bring this conference to an end. And as we go, we want to see the video on the Mexican Guadalajara 40th Union World Conference on Lung Health. Thank you very much.
Del río, son mil palomas tu caserío. Guadalajara, Guadalajara, hueles a pura tierra mojada. Colomitos lejanos. Ay, ojitos de agua hermanos. Ay, colomitos inolvidables como las tardes en que la lluvia desde la loma no nos dejaba ir a esa bomba. ¡Qué pueblito! Saborosos jarritos. Hace más fresco el dulce tepache para la birria junto al mariachi. Que los pañales y alfarerías suenan con triste melancolía.
Palpitan del alma. Que escuché otras campanas.
Como las graves de tu convento, donde se alivian mis sufrimientos. Tristeza papa en mi sala abierto, donde son frailes mis sentimientos.
Laguna de Chapala. Tienes un cuento la marcha.
Cuentos de ocasos y de alboradas, de enamoradas, noches lunadas. Quieta Chapala es tu laguna, novia romántica como ninguna.